All right, so Mental Health Awareness Month. And right now, we're doing a phone bank.
That's right.
So we're seeking solutions because this is a conversation. This is a topic that is so important. And so we have this mental health phone bank. You can call the number right now, 704-329-3703. And look, if you're in a crisis, call 988. And so I want to make sure I get you the correct information. So we have the phone bank until 1 p.m. So you got about 30 minutes. And then don't worry if you missed that time slot, from 4 to 7:30, that phone bank will continue again until 1 p.m. and then it'll pick back up between 4 p.m. and 7:30 p.m. So again, an important conversation when it comes to mental health. We were talking about it, Carlene, before the show about, as a kid, I didn't have that conversation.
No, I didn't either.
Like, mental health for what?
Yeah.
That was basically, I grew up in a very religious household. It was, we going to pray it away. We can pray it away. And there's nothing wrong with that.
We had a keep on keeping on sort of mentality at my household.
Right.
For sure. It's just keep on keeping on.
But it is important to have these resources, tap into these resources. Speaking of these resources, we have a special guest here. I love guests. I get excited about guests. That's what I tell Carly. We have Kim Hudson with New Hope Treatment Centers. How are you doing today?
I'm doing well. How are you?
I'm doing well. Talking about mental health and asking people how they're doing. I'm getting used to telling my truth when it comes to that, because usually I'm fine, I'm good.
Yeah.
And sometimes you're not good.
Right. Yeah, and sometimes you're not.
Yeah.
Yeah, but a lot of times when you meet strangers, you don't want to just go into rambling about all the things that you're feeling.
Right.
But you want to speak those things, saying that you're well, working on your mental health and just learning how to get into a place where you can honestly say, I'm doing well, I'm okay. But it's okay not to be okay.
Right.
Yeah.
We were talking earlier. You're from Chester, South Carolina.
Yeah, the big city of Chester, South Carolina.
I kind of in the intro I was talking about growing up. I'm from High Point. We didn't have that conversation growing up. Many families didn't have that conversation in my neighborhood. Was it like that for you?
It was. It's a stigma that was attached to it. Sometimes certain cultures, feel more strongly about reaching out for help outside of the family unit than others do. Sometimes parents or guardians feel like, people are going to think something's wrong with you or with us. So they don't want to talk about, things that could be happening to them mentally.
Yeah. So you, how long have you been with New Hope Treatment Centers?
I've been with New Hope almost 6 years now.
Oh, wow. Has it felt like 6 years?
Honestly, it hasn't. I know that it sounds like, it has, but it has not been, because I'm doing something that I'm really passionate about, and I can see the fruits of my labor, so to speak.
Yeah.
So I'm continuing to see things grow, continue to see things change, and that makes it all worth it.
For those who are unfamiliar, can you talk about the services you guys provide?
Yes, New Hope is a psychiatric residential treatment facility, and that just means, that it's where they live, and we service youth that are 12 to 21 that have a history of trauma and abuse. And so we lean into some of the most difficult youth in the country, or some of the most difficult behaviors. And so we offer, we have on-site therapists, we have certified teachers, and we have 7 different communities that are in the building that all have different diagnoses, that all have staff that work with them with whatever their needs are specifically. Wow. And so we just make sure that we want to set them up for success. And we believe at New Hope is starting with compassion, of course, and we believe everyone deserves to feel their best.
Why is it so important to be so proactive? I mean, because you're dealing with young people. Why is it so important to be proactive?
It's important to be proactive so that we can identify the issues while they're young, so that they won't develop into adulthood, or if they have to have those issues in adulthood, but making sure they have the right treatment. But it's important to be proactive so that we can create a culture of empathy, and so that people won't feel isolated or feel lonely, and to make sure that we're giving them the support that they need. So it's important to be proactive because it helps with a lot of things, your physical health, your relationships, and different things like that.
And it really sort of translates into adulthood, because I'm thinking, you're talking, I'm like, man, as a young person, as a teenager, man, I really wish it was pushed, for me to have a therapist, for me to have those resources. And it just, again, it translates to adulthood and what you guys are doing.
A lot of times, we say the saying, hindsight is 20/20.
Yeah.
But I saw a quote where it says a child's worst enemy could be an unhealed parent. So it could be an unhealed parent or an unhealed adult. But it's important that we make sure that we're mentally healthy.
Yeah.
That we acknowledge the things that we see different in ourselves or in our youth, and that's just being, when you isolate yourself from friends or family or your normal habits that you have. So you just want to acknowledge that, and just develop some self-care. Self-care is very important.
Yeah.
Healthy diets, exercise, or deep breathing, or writing in journals. But those are skills that have to be taught. Those are coping skills, healthy coping skills that have to be taught.
Do you guys work with the parents too? Because how do you? Because a lot of times, as kids, we're hard on our parents. We think our parents have all the answers,
Absolutely.
and they don't. Sometimes they don't have the tools.
Absolutely, we do work with the parents. We have what we call a treatment team once a resident is in New Hope, but then we have transition specialists who work even when they're transitioning out from New Hope to another level of care. But we do work with the parents. They have CFTs where they have, family treatments together and different things like that. But we encourage parents to be involved in the treatment because our goal is for them to return to the family.
What does, as adults, when we think of self-care, we think of, maybe going to the spa, maybe going for pampering. There you go. What does that look like for young people, self-care?
So, as just watching with the youth I have and just raising my teenage boys who are now adults. But self-care, first of all, is creating a safe place. Making sure you're creating a safe place, encouraging the dialogue, talking about their interests, recognizing the things that they're going through or struggling with. Social media plays a big part of where the self-help care is for youth right now. So it could look like them just playing the video game all day, which as parents we might not want. We want to reduce that screen time, but it's just creating an atmosphere of a safe place, having and encouraging the dialogue, that they can have the conversation, and then setting healthy boundaries and routines, like with healthy, foods, healthy exercise, or just healthy conversations. But setting boundaries is key.
I'm watching this show. I don't know if you're familiar with Forever on Netflix. It's a teen drama, but it really goes into the relationship of the kids' parents and their teenagers, right? And so what I really like is the conversation amongst the parents and the kids. And I say all that to say because you said you're a mom. What is that conversation like with your kids when it comes to mental health and dealing with certain things?
Because I've kind of done this kind of work for a long time. My boys and I have a good relationship because I understood the importance of talking to my children. I felt that maybe, like you say, sometimes we're hard on our parents, that we couldn't go to our parents about certain things. Sometimes my boys overshare, and I'm like, you want to tell your mama that?
Yeah.
But that's good that they feel like that because I've created that safe place while setting boundaries. But humans are social beings, so having a strong social foundation really can help with mental health. So we want to make sure that we're able just to have the conversations with our children or youth, but we have to make sure that we're mentally healthy as well.
Oh, man. Dude. Yeah. Carlene, you got anything?
If there's a parent out there that kind of wants to start this, but maybe is struggling, like kind of how we were raised is more of keep on keeping on.
Yeah.
What's a jumping off, whether we're sort of like spark a conversation with the kid? Like what's the first couple of questions or something you can ask with your child to start get that conversation going if maybe a parent's not comfortable with their own sort of mental health.
And that makes sense. So first, if they can just acknowledge, what you're feeling, but just start the conversation, talk to someone. I always encourage seeking professional help if you need it. A lot of times jobs have what they call employee assistant programs. So talk to someone there in confidence, talk to a trusted friend or a spiritual, person that they feel comfortable with. But it's just really acknowledging what you're feeling. And then as you talk to your youth or your children, ask them how they feel. They probably, I'm good. They're probably going to say that, I don't want to talk, you're nagging me or something. But you just still want to create the conversation and encourage the dialogue. But it's acknowledging, what you're feeling and seeking help, whether it's professional help or otherwise. You want to seek those support systems.
Okay.
I got one last question before we get you out of here. Over the 6 years you've been with New Hope, how have you grown?
I've grown because even though I had supervisory experience before I came, I started as a direct care floor staff, went to a team lead, a supervisor, and now a residential director. So I've grown, and just it's made me more self-aware of myself.
Wow.
You know, I've been able to see things in myself that I needed to change, or some of my biases or stereotypes that I had of certain things. You know, now, like you said, you know, just like how I go to the spa or go to get my nails done, I'm looking to see, hey, you know, I need to go talk to this therapist or talk to this person. I'm not afraid to express how I feel without feeling like it's something wrong with that. So I've just grown in just my openness to really just look more into myself and to be the best version of myself so I can help the youth that I'm servicing.
Well, you're doing incredible work.
Yeah.
Thank you.
You guys are doing incredible work. That's why we wanted to partner with you guys with this phone bank. And look, you still have time. I'm looking at the clock right now. About 20 minutes. Go to the phone bank. That number right there on your screen, 704-329-3703. And if you're in a crisis, call 988. Kim, thank you so much for your
Thank you.
time. Oh, you
Thank
were
you.
incredible. I wanted to hold you in here longer than this, but I know you got things to do. The phone bank,
Lunch to eat.
lunch to eat.
Yeah,
I think we're invited to lunch. I don't know.
See, that's self-care.
That's self-care.
Self-care.
That's self-care. Kim Hudson, thank you again.
Thank you.
Thank you.